I woke up this morning to some big news. You guys woke up to it too. That's right. The CDC's director, Dr. Rochelle Walensky, has gone against what the CDC panel has recommended in terms of who is eligible for a Pfizer COVID vaccine booster. She went against it in one particular area. I did a video yesterday, you guys might remember, on who the CDC panel recommended for COVID vaccine boosters. I told you yesterday they recommended 65 and older, those who live in long-term care facilities, those 50 to 64 with high-risk conditions, or rather underlying conditions, those 18 to 49 with underlying conditions who feel they are at risk in conjunction with their doctor, but who was not sort of recommended to get a COVID booster by the CDC panel was healthcare workers, people at occupational exposure risk for COVID. That means those who work in correctional facilities, teachers, etc. I told you I was a little surprised by this. And a lot of other people I think were as well. Well, in a sort of a stunning reversal, or rather a stunning sort of act, the CDC director did not accept those recommendations in full. And why that's significant is that the CDC director usually accepts what the CDC panel recommends. It usually is a sort of a formality that the CDC director, I don't want to sort of diminish it to formality, but they usually sign off on what their panel recommends is the point. And I've been told that it's very seldom in history happened that the CDC director does not go along with what the panel says. In this situation, we woke up to news this morning that Dr. Rochelle Walensky did not go along with her panel entirely. Yes, she says 65 and older should be getting Pfizer boosters. Yes, those in long-term care facilities. Yes, 50 to 64 with underlying conditions. Yes, those 18 to 49 who feel they are at risk in conjunction with their doctor can get a booster. But she says that people who are at occupational risk for COVID, who have occupational exposures, maybe those who are caretakers, those who are teachers, those who work in long-term, let's see here, certain facilities, those who are doctors, healthcare workers, right? Those who work in homeless shelters, correctional facilities, you name it. We now can get the COVID vaccine because she says that these groups should get it. This is a big deal. This is good. I mean, literally within a number of hours, this opens up a whole nother group of people who can get the COVID vaccine. Look, this came after a lot of sort of strife and discussion. I watched the end of the CDC panel's discussion yesterday, and the vote was even close with the panel. It was like 9-6, 9 saying that occupational exposure should not get the booster versus 6 saying they should. So anyway, Dr. Rochelle Walensky says, yes, boosters are available for healthcare workers, etc. Guys, oh, by the way, this is the Pfizer vaccine only. We have yet to hear about Moderna and Johnson & Johnson. These boosters are available 6 months after you have completed the series. You can go out and get it now, okay? It is available now because the CDC director has weighed in. Big news, guys. Go out and get your boosters. I'll keep you updated with more. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. If you have not liked and followed my page, please do. I do daily videos. For those of you who send stars, I respond to you directly. Guys, I love you. Bye.